Hi, this is April. I am presenting my week 2 open EMR assignment for Dr. Randy Rutledge pertaining to the open EMR that we were supposed to go in and create certain things under different admin roles just to see how the system worked and how we would address issues as a project manager and discuss the pros and cons of working within this particular EMR system, and present any examples what we would do as far as project planning to overcome any of those issues. Now, the pros and the cons that I noticed about this particular system, the pros being that the navigation bars at the top of the open EMR, these things here in the green, they were clear and concise, and the user could clearly tell where to go. And then there were drill downs that you could choose. For example, that's not a particular drill down, but if you choose one of those headings in the toolbar, it will have a drop down of other different criteria that you could use or select to basically take you where you needed to be. Like, for example, this one here, I went to the open EMR and I went under administration, and I wanted to add a facility, so it had the selection of facility, which basically opens up a new tab for you right here. Takes you right where you can add the facility, and then the next screen looks like this, where you put in all the information for the particular facility that you're wanting to add. You can add all this detail as you want to, and then you hit save, and it takes you back out to your facility screen, and you will see your added facility there. That's what I liked about it. And like I said, the drill down links, they're embedded in the screen to take the user to the other info without opening a new window, which could slow down a device, such as if a user was using their iPad to do this. And it would cause it to run slow. We have a lot of problems like that on my existing work. Another thing that I liked about this system was that the way the physicians, when it came down to the physician portion, in this step here that I did, I liked the way that a physician could set up his or her own schedule. It appeared to be when setting up in this open EMR, they can basically alert the facilities, like they can go between that great clinic and the women's health clinic that I had submitted, and tell them, I guess, what they would be in the office for, the duration that they will be in, what day they were going to be there, and why they were there. They can put a comment here. As you can see, on the first one, I just basically set it up, and then it goes to the calendar, and it looks like this, and take off that whole block of time for that particular day that I had set it up. But the next physician, I wanted to see what it would look like if I put in like a comment. Would that comment actually go to the calendar for the facility to see? And when I did so, I ran into an issue. Well, not really an issue, but this is a system stop. It's a hard stop too. It wouldn't allow me to go any further without filling in this information here in this box. If you can see it, it's like the until date. That's basically, I guess I had to put a date in there to tell them when I will be in the office and for how long. So it wouldn't let me move any further until I put in that particular message the until date. And then when I did, it took me back to the calendar for the date that I wanted to go to this particular facility, the Women's Health Center, and gave me and it documented the information that I wanted to have in there. So I'll know, as the physician, what I was there for. Now, as far as the cons are concerned, I found that the administration menu, it was very easy to understand what the data need was for certain tabs. But when it came to the physician role, adding him in, I'm not quite sure if, like I said, if these comments that I'm putting in the physician screen are basically for his view only, or if it's for the facility to view as well when they're trying to schedule patients for him, so they'll know why he's there, what time frame he's going to be there, and what type of patients he wants to see. I also found that for the physician's role, screens were a lot less user-friendly, meaning, like I was explaining earlier, they didn't have as many drop-downs, drill downs for you to understand better what you were using this particular portion of the screen for. I would like to see that be, the provider may need to have a, let me see, I said found that the physician role screens a lot less user-friendly. However, it did provide more detail to a provider than he or she may need. And that's another concern of mine, that under this particular screen, I think it was, let me see if I can get to that. This is a portion of the billing screen where the provider can see for their patient, like what type of services are past due. Like this person needed a BP blood pressure check done and another assessment as far as tobacco was concerned. But also the provider can also see, like, get detailed information about the person's, track their vitals from one visit to the next. I thought that was pretty good as well. But the one thing that concerned me was that he or she, as a physician, has the access to see the billing information. Now, coming from an AR billing background, that's a good thing and a bad thing in a way for physicians, because a lot of times they don't understand why something is being billed at a certain amount. They think it should be a little bit higher all the time, when not necessarily will be. And they think they're looking at what amount has been billed, or they think they're looking at the amount that they're getting paid, and they think they should get paid higher. So they're constantly calling saying, hey, why are you billing for that? And you should be billing for this. So I believe that this screen can needs to be a little more added to it if it's going to be where the physician can see it, so it'll cut down on confusion. So that's basically my pros and cons list. Like I said, I think that there needs to be an assessment as far as the client, the level of access that certain patient and facility information that can be shown to all the users of this particular EMR. And I want what is the current EMR infrastructure, and will this new EMR interface with the current system that they have in place? Those would be, as a project manager, two of my top concerns as far as this EMR is concerned. I hope that you've enjoyed this presentation, and please provide all the feedback that you would need, that I need, to help me get better at presenting and looking through this information for you. Thank you. Bye.